Get on your hands and knees. Tuck the problematic leg inwards so that the side of your leg rests on the floor. Then, slowly slide the other leg backwards as shown. You should feel a tightening sensation in the buttock. Adjust your position so the stretch sensation is focused on the piriformis muscle. When you are there, gently rock as shown to accomplish the stretch. You can also stretch your piriformis muscle while seated. Cross the affected leg over the other. Grasp your knee with both hands. Pull upwards and towards your opposite shoulder until you feel the stretch in your piriformis muscle. You may need to slightly adjust the angle of your pull to target the muscle just right. Hold for about 5 seconds, then relax. It is okay to stretch both sides. Another method is to cross your affected leg's ankle over the other knee. Then lean your body forward at an angle with your arms extended until you feel the stretch. Hold for a few seconds, then switch to the other side. If you are fortunate to have access to a power plate, you can use it to recondition your piriformis muscle and associated pelvic muscles. Step on it with your knees slightly bent. Set it to its highest vibrational setting and stand stationary for 5 minutes. Next, while balancing yourself with one arm, stand on the affected leg as shown. Focus on contracting your piriformis muscle to contract and rotate your body over the axis of your leg, back and forth. Do not twist from your waist. The movement should all be generated from your hip rotator muscles. Next, focus on your hip abductor muscles. Contracting these muscles properly will cause your pelvis to tilt upwards. Do not simply lean your body to the side. The movement should all be generated from your hip rotator muscles. Lastly, do full squats. Grasp the handles of the power plate and squat down until your thighs are 90 degrees to your legs, then come up. Do 12 to 15 repetitions of each exercise. Tie a high-resistance TheraBand into a loop. Sit and bend your knees about 45 degrees and slip the loop over them. While balancing yourself with your hands, slowly open your knees against the resistance, concentrating on making your piriformis muscles do the work. Do 10 repetitions twice a day. To increase resistance, double the loop or untie it and make the loop smaller. The bird dog exercise strengthens, balances, and coordinates the core muscles, which are your abdominal and lumbar muscles, as well as the gluteals. Get on your hands and knees. Simultaneously raise your left arm and right leg as shown. Hold this isometric position for a few seconds, then repeat for the other side. Do 10 repetitions per side. The donkey kick is primarily designed to strengthen the gluteal muscles. Get on your hands and knees, then raise your leg behind you as shown. The movement involves pointing the bottom of your foot straight towards the ceiling. As it gets easier, try them while wearing 5-pound ankle weights. Do 10 repetitions for each side. Next, hip rotations. While this exercise strengthens and coordinates all of the hip mobilizer muscles, it may be too aggressive for your condition. If you feel like a gluteal muscle spasm might occur, discontinue. Get on your hands and knees. The exercise involves raising the leg and carefully transcribing large circles with your hip as shown. Focus on contracting the involved muscles as you make the circles. Do 10 complete circles twice a day. Lastly, do wall squats. Stand about 18 inches from a bare wall and place a massage roller behind your lower back. Bend your knees and lower yourself into a squat position until your thighs are parallel to the ground, then come back up and repeat. Do 12 repetitions twice a day for maintenance. Squats are excellent exercises that are easy on your joints. They strengthen and coordinate your glutes, quadriceps, and hamstrings, which can be protective against sciatica due to piriformis contracture.